At this point, we've decided to risk stratify our patient into three categories, A, B, and C. Category A patients are patients who are having symptoms that warrant being evaluated this particular week. They could be having decompensated congestive heart failure, active chest pain, or arrhythmias such as atrial fibrillation. We want to evaluate those patients, whether it be in the emergency room or in our offices, or have them have diagnostic testing such as echocardiograms, or for that matter, stress tests within the next week. Category B patients can wait approximately 2, maybe up to 4 weeks. It's not urgent, but it's not something that we can forget about anytime soon. And then category C patients are patients that can easily wait for their diagnostic workup to be completed in 2 to 4 months. Depending upon the patient's symptoms, they may be evaluated in the office, they may be evaluated in the emergency room, or we may urgently ask them to have a procedure at the Chester County Hospital this particular week. If you had to come to the hospital to have a study or a heart catheterization, you will be formally COVID tested. And that's to protect you, protect other patients, and to protect staff. So we will know what your COVID status is 24 to 48 hours before your diagnostic procedure. Patients fear that they may be infected with the COVID virus in the emergency room. They may fear that they may have long wait times in the emergency room and potentially get exposed. They may fear that they have to go to the emergency room and they will not be able to be with their family members. Or they may fear that if they have chest pain or shortness of breath, that in fact they have COVID-19. A lot of those fears are actually not the case. In that, when patients do have chest pain and do have shortness of breath, it's more likely that they do have a true cardiovascular diagnosis due to coronary artery disease or congestive heart failure that warrants them coming to the emergency room, where actually the wait times are minimal. Here at the Chester County Hospital, we have sort of geographically distinct emergency rooms where we are able to risk stratify our COVID patients in one part of the emergency room and our non-COVID patients in a different part of the emergency room. Via televideo medicine, we are able to the best of our ability, figure out whether if someone is having decompensated congestive heart failure or unstable chest pain that could put them at risk for a heart attack. My concern in those patients is if they're having active chest pain, active chest pressure, that they not wait and they come directly to the emergency room so that they do not present late for a heart attack, which can cause them to have a very complicated course. Weight gain, shortness of breath, increased abdominal girth due to fluid retention, increased swelling in the lower extremities, difficulty sleeping at night because of shortness of breath, all are signs and symptoms of congestive heart failure that, if not addressed in the emergency room, could cause the patient a much more late, complicated course, when in fact if they presented earlier, we could turn around those symptoms quite quickly. There are over 50 cardiovascular professionals here at Chester County Hospital. It's very important that you keep in touch with your physicians, nurse practitioners, physician's assistants, and surgeons so that you can constantly let them know if you're having any problems or symptoms. You can do this by way of telemedicine, televideo medicine. All of the offices are open and the phones are ready to take your phone call. But you'll also see on our hospital website virtual teaching sessions for patients who have diabetes, congestive heart failure, where you can also learn how you can manage your conditions at home, answering those questions, and contact those people if need be. Most importantly, we are still going to follow the CDC guidelines, which is socially distance beyond 6 feet, frequently wash your hands several times of the day, wear masks when you are, for example, grocery shopping or are coming to the hospital or you are in a public place. Cover your nose, cover your mouth when you have to sneeze so that you do not expose others. From a cardiovascular perspective, during this time, I still want people to maintain healthy diets, get on their scale every morning to watch their weight, and if they're capable, take a daily walk. It's a stress reducer. They will definitely feel better after going outside during this spring, which will also help them with their mental health.